I'm the Chief Executive of this hospital, the Brighton and Sussex University Hospitals NHS Trust. This is a short video to introduce you to the work of the hospital and to meet some of the staff and to see how one patient experiences the journey through the hospital. We want to get you involved. We want you to be involved in any way that you feel works for you. If you want to get involved, just ask, because we're going to help you in every possible way.
Whichever way you arrived at the emergency department, whether via ambulance or referred by your GP or self-presented after a minor illness or accident, we do understand that this will be an extremely worrying time for you. But please be assured we have systems in place to keep you safe.
Oh, are you still in pain, Mum?
No, I think the painkillers they gave me had started to kick in. But I'm worried about the hospitals and the MRSA.
In every hospital, there are many background activities that go on to protect staff and patients. One of these activities is cleaning. The responsibility for cleaning is divided between the chief nurse and the director of facilities, but you should expect to find your area is clean and ready for you when you arrive. If this is not the case, or if there is something that happens during your stay, you need to bring this to the attention of a member of staff as soon as you can.
Nearly there. The radiographer will be out soon. I'm not that busy this morning.
When we first meet a patient in the waiting area, we need to just make sure that we have the correct patient in line with the trust policy. We check their date of birth, their first name, their surname, usually the first line of their address, and we also check their trust ID band. Did you land on your hip?
Yes, I landed on here.
On your left hand side, is it? Okay, what we're going to do, we're going to take two pictures of your hip. We're going to do a front picture just as you are, and I'll move you around, we'll do a side picture as well. You okay with that?
Okay.
Excellent. Whenever anybody is in hospital, if they don't know what's happening, just ask, and we can always explain exactly what we're going to do.
Mrs. Bellamy? Sorry to wake you. I'm John. I'll be looking after you today. I need to make sure we've got your details absolutely correct.
We would always check the patient's full name, we check their date of birth, and they're all given a unique identifying number, an NHS number. So we would check that from the patient's notes, and then we would put that on a wristband for the patient, and they would wear that the whole time they were in hospital to make sure that the right patient gets the right treatment every time. During the assessment, the nurse will assess your skin condition to make a decision whether a special mattress is required to protect your skin during your hospital stay. Part of the assessment will also be about assessing you as an individual. We want to know about all your medications that you take, even herbal ones, because sometimes these things can interact with the treatment regimes we would prescribe. And again, safety is always our main aim. If you have any problems during your stay, the best person to speak to is the ward manager. If the ward manager is not available, then the nurse in charge is the next best person. Sometimes people have different coloured uniforms on, and if you're not sure who's who, then just ask.
So Mrs. Bellamy, we've talked about the operation tomorrow. Now what I'm going to do is mark on your skin. I'm going to use an indelible marker. So if you rub it, or if it gets wet, don't worry, it won't rub off. Now, is there anything else you want to ask me, or is there anything that you're in doubt about?
Part of the consent process is to have the conversation about what the risks and benefits of the procedure will be, as well as the risks of not going ahead. While some procedures and operations have known complications, it is of course possible that other unexpected events can happen. If that were to be the case, then clearly the patient would be informed of that. It's important that the patient will be given an opportunity to ask questions about the procedure so that they feel fully informed about what's going to happen before they sign the consent form.
Here's your painkillers. We're here in the pharmacy dispensary, and this is where we prepare your medications. So that will be the medications that you're taking throughout your hospital stay, and also the medications that you'll be given on discharge from hospital. You will also have a ward pharmacist that you will see on a daily basis. We work very closely on the ward with the doctors to ensure that you are receiving the most safe and the most appropriate medication for you and your medical condition. If you have any questions about your medications or any queries, feel free to ask the ward pharmacist at any time.
Now these tablets will be the last thing you eat or drink before you come back from the theatre.
So I can't have anything else now?
No, nothing at all, I'm afraid. Not even a sip of water.
If you have an anaesthetic, you may end up in a room much like this, the anaesthetic room, which is just outside the operating theatre itself. You will have been seen by an anaesthetist already on the ward who will have looked at your medical history and the operation that you're having and then have spoken to you about the anaesthetic that's most appropriate for you. When you come into this room, again, certain important things will be checked. Your consent form, when you last had anything to eat or drink, whether you've got any allergies to any drugs or medicines. Once those checks have been done, you will again be asked if you've got any more questions. And if you do have, just ask.
I'm going to take you to the pre-op room first, where they'll check.
I know that I'm still Mrs. Bellamy.
And that the consent form tallies, and a lot of other things.
She'll be alright, won't she?
She'll be just fine.
Mrs. Bellamy, how are you feeling today?
Much better, thank you.
Excellent. I'd like to take a look at your wound to see if everything is healing as it should be.
Part of my role is to put systems in place where we minimise the risk of infection. So you may well have noticed that doctors don't wear ties anymore. We've also put in place that they don't wear watches or any other jewellery. This helps with being able to wash their hands effectively. So patients and carers can also be involved in minimise the risk of infections by making use of the alcohol hand rubs when they come into the ward areas, by also not interfering with any wound dressings or touching any lines that may go into the veins in the arm, or indeed lines that go into the veins in the neck.
Okay, Margaret, do you want to start walking your legs towards the edge of the bed?
You sure?
She'll be fine.
Your privacy and dignity is very important to us. It's important that your bed space and your area becomes what you want and what you need. Don't be afraid to ask. We do endeavour as a hospital to make sure that there are same-sex bays and same-sex wards, but this isn't always possible. We are committed to our core values, which are about respect, integrity, responsibility and culture. Your privacy and dignity is important to us. Please make sure that you express your needs to the nursing staff.
How are you feeling? Catch your breath? Feeling giddy at all?
Well, one of the roles of physiotherapy in the hospital setting is to get patients back onto their feet following surgery or after a period of illness. We might be providing walking aids such as a stick or a frame to help with that, and it's important that it's the physiotherapist that assesses for this and that the equipment's used appropriately. We also continuously monitor our patients' rehabilitation programs and try and progress them as far as possible with a view to getting patients back to their previous level of function or better.
Excellent. How are you feeling?
Fine.
You're up.
I'm glad you're here because we're just about to go through the discharge planning. This is Natalie, by the way, a dietitian.
Hello. It's amazing how many people don't think through what's going to happen when they get home, especially with food. Cooking's not very easy when your mobility's reduced.
Food and nutrition is of great importance when someone's unwell and admitted to hospital. If you're unable to eat adequate amounts of food whilst you're in hospital, you may be referred to the dietitian for advice. We encourage nutritional intake by the development of menus providing tempting meals that are nutritionally adequate, and also protected meal times to allow the individual time and space to eat their meal without interruption. Where necessary, we can supply additional foods such as snack boxes or cakes or sandwiches, and also nutritional supplements to ensure that you meet your nutritional needs. When you're planning to go home, it is important to look at how you're going to be doing your shopping, who's going to be preparing your meals, to ensure that you continue to get adequate nutrition at home.
Gary's just parking the car, Mum.
Here are your tablets to take out. We've written to your GP to tell her about your new medication. Also, you have an outpatient's appointment here at the hospital.
Discharge is really a process that starts from the time that the patient's admitted into hospital. If patients have got any questions that they want to ask about their condition, it's really important that they ask the day that they're going home.
You ready to roll?
You won't be needing these anymore.
For whatever reason you're in our hospital, remember this is your hospital and it's about your care and you are part of the team. Thank you.